Is there a way to identify what would be the safest way there? Like how to identify the joint and where the hip joint should be in terms of how wide you put your legs versus it being muscular tightness, whether it's adductors or hamstring muscles?
I'm talking about skeletal uniquenesses and how we kind of respect that. And yet we're not just a skeleton because we're a dynamic structure. Every position we put ourselves in, you've got not just the muscles like the adductors on stretch and the hamstrings on stretch, which for sure they both are happening and can be limiting factors. Fascia is really, and our nervous system is really wound up in that position. So if you think about your brain, coming out of your brain is your spinal cord. Coming out of your spinal cord at every level of your vertebrae are all nerves that go to all extremities.
Welcome to Stronger Bones Lifestyle Podcast. I am Debbie Robinson, your host and guide on your Stronger Bones lifestyle journey.
Today's guest is Lori Rubenstein Fazzio. She earned her doctorate in physical therapy from Massachusetts General Hospital Institute of Health Professions, her master's of applied science from the University of South Australia, and her bachelor of science from Boston University. She is a certified yoga therapist through the International Association of Yoga Therapists and is a frequent speaker at professional conferences. Her research interests focus on the subtle body and pain management and the intersection and application of the philosophical science of yoga with the clinical science of modern medicine for improving eudaimonic well-being. She pioneered the first yoga therapy internship at Mann's family clinic in Venice, Los Angeles, California, where interns from the LMU gain mentored experience and provide individualized yoga therapy with an integrative medicine clinic for patients suffering from chronic pain. Her mission is to expand this model into other healthcare and educational settings. So, Lori, welcome. I'm so happy to have you here speaking with us on Stronger Bones Lifestyle Podcast.
Thank you, Debbie. I'm so excited to be here with you.
Okay, so let's get right into it. So why I asked you here is because I saw that you were doing a talk somewhere and the title was Skeletal Uniqueness. And that was so intriguing to me. So I would love for you to explain to us what that means.
Sure. So as you know, I've been a physical therapist for like over 35 years. And a lot of what we do in physical therapy is assess somebody's musculoskeletal body. And part of that is recognizing that our bodies are not symmetrical right or left. Even if we look in the mirror, we might see one eye is different than the other. But what we don't sometimes recognize is that internally we're not symmetrical either. And so people always think, oh, my feet should face the same direction, or this shoulder should be the same as that shoulder. And so part of my physical therapy training was in identifying, yes, when is it more of a habitual pattern? And when is it actually their structural uniqueness or their structural makeup? And so part of that led to what my work in yoga is. I have many yoga teachers or yoga practitioners who would come into my practice and they would say, I complain of chronic pain in one side of their body, like their hip, or they'll say it was their SI joint or it was their shoulder. And they would oftentimes show me how they would do a posture. And they say, I can do it on this side, but I can't do it on this side. And then they'd be forcing their body to try to do it on the side they couldn't do it on. And so through my assessment, I would identify, well, the problem, the reason why you can't do it so well on this side is XYZ. And there could be variations as to why that might be. We can talk about those if you'd like. Or for example, back bends. Some people just can't do certain back bends. And then I would assess their spine, look at their x-rays and say, well, you know what? Your spinous processes, your vertebrae. So the back part of it, the spinous process, are very long. That means when you go backwards, they're hitting. So you're creating stress to your spine and potentially injury by trying to backbend more. Your body's not meant for that. And so we try to honor what each of our uniquenesses provide for us and respect those uniquenesses so that we can keep our human earth suit longer, healthier longer, which I know you're committed to with all the work that you do. So moving forward, then I have some assessment tools that are really simple for people to do on themselves, where if they're not going to a physical therapist, they can get a general sense of, oh, maybe this is the way my body wants to go today, and this is a way I should take care of it. So, but I would like to highlight that there is Paul Grilly. Do you know Paul Grilly? He's very known in the yin yoga.
Mm-hmm. Yes.
So he's the only one I had met, kind of not met, but I had encountered. I've met him years ago, actually, but had encountered doing this in the yoga world. And so on his website, he has real images of real bones where they demonstrate the differences in bones. So one femur, if this is the femur and this is the head of the femur, one might be this angle, this angle, this angle, this angle, this angle. One might have a long neck, one might have a short neck, one might have a larger ball or smaller ball, all these uniquenesses. And he's really done a wonderful service in that he's offered these images for people to borrow. So I use those images to help teach people, look at the differences. Your hip socket faces this way on one side and that way on another side. So you're never going to do a posture the same without causing potential harm.
Wow. So then I guess interoception or body awareness when you're practicing, especially if you're practicing yoga, would that be then you're just really inside your body, and when you go to a place, you have to really like know what that place is where you could either pull too much or injure yourself, right? You have to develop that awareness.
So I guess there's a few components. So one of them is awareness, and awareness, because I recognize not everybody is going to have that capacity. It's not really realistic. And to trust what we feel is always questionable if we're new to the practice. People might really not be able to discern the difference. And without an X-ray or MRI or some imaging, we don't really know what's happening inside. So these assessments give us a general sense. So first is developing awareness, and I offer some guidance. So for example, these are general guidelines. Again, nothing replaces an individual assessment. Just like you might teach a group class, but like you might run labs on somebody, and without those labs, you don't really know what's going on. But the symptoms, like you can face the symptoms, and then you have to do the labs to really see what's happening. So without doing the imaging, we can work a little bit with the symptoms to get a sense. So for example, typically, if you're feeling pain in a joint or something that's sharp or has a nerve quality, so a tingling or a numbness, those are typically the warning signs. And to break it down even more in the skeletal uniqueness, as we create a discernment, which is someone compressing or are they stretching? So for example, I'll do it with my hand because it's easy to see here. If I take my wrist this direction, which is what we call wrist flexion, I'm closing down this side, right? I'm compressing this side and I'm stretching this side. Yeah. So in the wrist, there's not a whole lot of compression because I don't even get all the way there. Right? But if I take my fingers, I can get all the way there. Yeah, I can get all the way there with my fingers. So if I turn my head to the right, I'm generally stretching tissues on the left and I'm compressing on the right. Right? The direction we're moving towards. Now the neck is unique because the muscles work when I turn to the right. My sternocleidomastoid on the left is doing the action, but we'll use this as a demonstration. So if I turn to the right and I feel it on the right, not on the left, there's a likelihood that I'm compressing on the right, particularly the joints, because we're closing the joints the direction we're going. So if somebody comes in and they've had neck pain or neck issues, and they go to do their yoga and they turn their head and they feel it on the right, I want them to understand that's probably not a good thing, right? That could be aggravating. If you feel it on the left, okay. So maybe you breathe, you release, you let go and see, does it change? That always works too. If you breathe, you relax and it releases, great. But try to give people guidelines. So It's a little more clear when we take the hip. So imagine bringing your knee to your chest, Apanasana. And people oftentimes think, oh yeah, I feel a nice stretch. And they'll say in my psoas, in the front. I think, well, you're not actually stretching the psoas when you do that, right? You're stretching the glutes, you're stretching the back side of the hip. So if someone brings their knee to the chest and they feel it in the front where they're compressing, that's something we want to avoid. So try to educate on what's compression and what's stretching. And that's very generally by, if it's the direction you're moving into, that's compression. And it's the direction you're moving away from, that's a stretch. Does that make sense?
No, it totally does. And that's really great because you're either pushing the joints into themselves, pushing the bones into themselves in a compression. And whether there's bone spurs or arthritis or issues, I mean, I don't even know what the myriad of issues are. When you're pushing them into each other, that's when you're going to get probably more of that. You could even get some of that nerve impingement, the nerve pain that you were describing.
Yes, you can impinge a nerve, you can impinge the labrum, you can impinge the tendon, all those soft tissues, or as you say, the bones themselves.
Yeah, so on one hand, we use compressive force to strengthen bones, but it has to be in your right zone. You have to have, and I know when I teach yoga, I am so descriptive because I want them to be in the hip and I want them to be feeling that. But now you're going to give me even more to think about when I'm describing this, because when you take people to their edge to create bone stimulation, you want it to be go to where your place is, where you're creating that stimulation. But now I'm going to have a new raised awareness in my description of know where your edge is and what is that pain. And if it does go to the place where it could be nerve, where it could be, is it burning, tingling, sharp, shooting? That would not be good.
Or pinching. So a lot of the for my understanding with the osteoporosis, we're looking at some axial compression, right? We want to have some axial compression, but we don't want to have where you're taking maybe edges. So for example, the hip is a big one because, so if we just look, if this is the acetabulum, so this is the socket, right? And then this is the ball. Some people have a deep socket. Some people have a shallow socket. Some people's sockets are angled this way, this way, this way, this way, right? And then we talked about the femur itself has all these variations. So if someone has a big lip on their socket and they will be hitting that. That's not going to help their bone density, right? That's the compression I'm talking about. Right. That's not going to help anything. That's going to create irritation versus this could have a great stability, things like that. So these assessments, so first step is, are you getting that pinching, right? Or are you getting a general stretch? Again, these are guidelines for a general class where we're not breaking it down piece by piece.
Right.
So for example, Apanasana, if somebody's lying on their back and they bring their knee up, keeping it close to the center of the body, many times they hit the acetabulum, they hit the socket because of the shape of it. So they'll feel it in the front. And if you don't feel it, sometimes what I'll have people do is bring it up and bring it across towards the opposite shoulder and you feel it in the groin. That's compressive. That is actually impingement. We call it femoral acetabular impingement. And so they can have this impingement. You can also get impingement in other areas, but this is the anterior impingement. So then what we typically do to find the shape of the socket, this is our functional test, so to speak, without having the x-rays or the imaging, is take the knee teeny bit wider and try it there. Take it a teeny bit wider, try it there. Find the least amount of wide, which is abduction, where you have the path of least resistance. That's where your femur is meant to glide. Right? So we're really looking for where is the path of least resistance where your femur can glide nicely. And that is where it's in more of what we would call like the center of the joint, so to speak. It's not riding up on one lip or the other lip, but it's gliding smoothly. So then let's say it's this angle, right? So when you bring your knees to your chest, bring it at that angle so you don't get that pinch, right? But now we take it upright. If you squat, that's where you're going to want your squat to be, right? Because when you're squatting, it's the same thing as Apanasana. It's knees to the chest, only you're taking the body down. So if you do the squat in that way, you're going to keep the joint healthier, and you can work on building the bone density without compressing those
Edges.
structures that lead to labral tears and hip replacements and all that stuff.
Oh my God. Okay. So fascinating. So how we strengthen bones is with the proper osteogenic load when the joints are aligned. So we're talking about alignment, and you're
Yes.
saying that each individual has their own alignment, right? And so
Yes, exactly.
yeah, so the skeletal uniqueness is, what is your alignment? And as you're describing the tests that you do without the imaging, I had so many of those with a torn labrum and then with a hip replacement. So every PT that put me on a table was bringing my knee in to my, my armpit and then going across my body. Even the orthopedic surgeon before I had my surgery was doing that, the PT. So that was, as you're telling me that, I'm like, yeah, I had that done a lot to try to figure out.
Yep, the flexion adduction test for impingement. Exactly.
But I'll tell you one thing, my yoga practice, this is what my yoga practice did for me. So even, when I had my hip replacement, my doctor came out of surgery and said, your hip was a bloody mess. It was a bloody mess so it was really a lot of wear and tear. He did that assessment on me, as did my PT before I went in. My PT before I went in, he said, I'm 97% sure you do not need a hip replacement because you test really great. And then my orthopedic surgeon, he did the same thing. He goes, you look great. You're walking great. No limp. What is it called? Trendelenburg. You're looking great. And so he goes, but I'm going to look at your imaging, because he had an x-ray. And he goes, this will tell me. And he turned and he looked at the x-ray and he said, you are bone on bone, and it's up to you when you want to have your hip replacement. And I had it a month later. But I think it's all the yoga that kept this like freedom, because I have hip dysplasia, probably have congenital hip dysplasia, which is why why all this happened. And
so that's a unique, which we'll talk about in a minute. Go ahead. Yeah.
Yes, I wish I would have known that, because then I wouldn't have, but whatever. I mean, I'm here, and I really believe that I'm here for a reason. And this is just the journey that I had to go on to get here, and I'm okay with it. But yeah, it's really interesting. So if I were assessing someone, or having a group of ladies assess themselves, or someone was assessing themselves, when you do Apanasana, knees to chest, and you bring your knee in, and for you, if it came straight in towards your shoulders and you felt some kind of impingement, that compressive force that wasn't appropriate, and then you moved yourself out to the side a little, and you did go towards the armpit, and you had more freedom. So when you're standing and you're doing a chair posture, or you're doing any kind of forward fold that's safe for bone health, whether you have a chair, you're coming to warrior 3, or anything, even a dancer posture, something where you're doing forward hip flexion, do they then have a wider stance instead of what's a typical foot stance? And then does external rotation, toes out to the side? Like, I'd love to know how women could find what's the proper way that they should stand and squat.
Yeah, so it's a great question. So is it okay? Go back, because there's one more piece I want to add in that
yes.
back to this, which is, so we talked about so that you're in alignment, right? And one of the benefits of being in alignment is that the muscles and even the ligaments, all the tissues around, are in their optimal position for their optimal function. So if you're stressing one side, you've got some muscles and ligaments that might be on too much of a stretch, and some that might be too much compressed, so they can't do their optimal function. And that leads to that lack of stability that can lead to many other problems. And for example, hip dysplasia, you don't really have a socket, right? The socket's not fully formed, so the doesn't know where it's going to go, and that's that wear and tear. So surgery can help. It's a correction for that, because we can't build a socket. We can talk a little bit after about what all the yoga keeps that synovial fluid, which is what keeps it lubricated. So we need motion, we need that lubrication, we need alignment, we need to not overwork, right? Because we need things to have a break. So then coming back to like standing postures. The Apanasana, when you do that test, you don't usually feel it until you're past 90 degrees. If somebody hits the pinch at 90 degrees, I'm sending them to the surgeon for an assessment, because that doesn't even allow you to sit in a chair without creating compression, right? So it usually doesn't happen to the end ranges. Most of those postures that we're talking about you're not getting to that range. So it's not as much of an issue. If someone's doing a full squat like a malasana, then yes, where we found that, I usually tell them that's your squat. With people that are doing Utkatasana, like the partial squat, I personally still have them go in that alignment. So when you do the Apanasana test, it's not just abduction, it's also that external rotation, because it's all happening from the hip. The bottom of the leg is just following. So I have them on their back. It's almost like a happy baby. Like, okay, where are you? Look at that. Imagine you're standing up. And when you stand up, that's where you'd want to be. But that wouldn't really work for like a dancer's pose or something, because you'd be so off center. But with dancer's pose, you're never getting that full compression. So it's sussing out. And again, going back to what are they feeling? Where are they feeling it? For example, in the ankle, dorsiflexion, which is when if you squat down, you have to close the ankle. That's the dorsiflexion. Some people have the talus, which is a bone inside the ankle. Some people have a large talus. So they can't actually dorsiflex more, right? So that's pulling your toes back towards your nose. They don't have the range. Other people, it could be because the calf is tight. The calf muscles are tight. The gastrocnemius, the Achilles. If the gastrocnemius, the Achilles are tight, where are you going to feel it? Stretching in the gastroc and the Achilles. But if you feel it in the front, then it's likely that you could be compressing, or the talus isn't sitting in the right position because you've had ankle sprains and it's hypermobile. So then that affects your ability to squat, right? Because you can't get it at the ankle, so you're going to try to compensate by leaning forward at the hip, and that's when people might feel it at the hip. So like what you do, where you look at all these tests to look at the whole picture, with this, we can't just look at one test. We have to look at the whole picture and how things fit together. And that's where it goes back to the person and finding, how do I not focus on making my body look like a picture of a pose, but actually, where does my body feel the most aligned, the strongest, the most accessible? That's really where I think the yoga has so much to offer, because we focus on, what are you feeling? How does it feel? Well, hopefully we focus on that. I don't think everyone does.
Yeah, you've got that mind-body piece that you bring to it. And I guess because I've had my hip journey, for me, safety, like I always use the word safe with strong. So yes, we're building bones and we need to create strong forces for bone remodeling. We have to create that mechanical force at the cell membrane so the bones are actually going to remodel, but we have to do it safely, because it doesn't make sense to do something and to try something if you're going to injure yourself, because that's why we're doing this, is to avoid injury. So yeah, that's really interesting. So what I'm really taking from this is how important joint alignment is, and how important having your mind in your joints when you're bending them and loading into them, so you can actually detect where is your safe space, what is the appropriate place for you, and knowing that there's a range. Like I always say, it's really about the journey and not the destination. Yes, to get to Warrior 2, we have 90 hip flexion and 90 knee flexion, if you can go all the way down there. But that's if you have the ability to get there. Bending at some range of motion in the hip and the knee is going to create forces that are going to build stronger muscles and stronger bones. So yeah, that's really great.
So for example, with the skeletal uniqueness of kind of using that even like in a lunge position, let's say, like if someone's going to go into a lunge position, so it's also that 90 in those positions, but maybe having the hands on the ground. If your arms are shorter and you have longer legs or longer torso, you won't be able to reach the ground. So you're going to have to flex your spine, which, with osteoporosis, we don't want to have that like flex spine. You're going to protract the shoulders. So now the muscles aren't working optimally because you've taken them far out of their more optimal neutral position for weight bearing. And you've compressed the hip more. That compression is not doing you much good. Put the hands on blocks if you have short arms. Activate the muscles, make the leg muscles work better. And that's putting all that together for that safety and optimal bone building, activities.
Yeah, that's great. It's liberating, honestly. It's liberating for people to realize that you don't have to try to fit into that box or look like that. I think that's really liberating
The-
for women.
Yeah, there's no, look at the bones online, you'll see the uniquenesses. The other big one is like in Warrior 2, right? So when you're in Warrior 2, we want the knee facing over the middle of the foot, right? Which means that you have to have a certain amount of external rotation to be able to get there. This is the one I see the most issues with, because if people don't have the external rotation, you can compensate in Warrior 2. And when you try to force it, that can lead to like overusing the piriformis and creating torsion on the sacrum, all kinds of things. So there's another assessment that you can do that is lying down. There's other assessments that assess how much internal and external rotation does somebody have. And when we do that, we get a sense of where the pelvis needs to face. So then when you're in Warrior 2, you can be like, yeah, my pelvis has to face this way for me to have optimal external rotation without straining something. So finding these little assessment tools can help us to have that alignment that then leads to all the things that you're working to do: build the bone, build the muscles, all that type of thing.
Yeah, and it's like the neighbors, right? The neighboring joints. So in the Warrior 2, you've got that hip and that external rotation. And if you don't have the ability to have it there, you're going to go the joint above, maybe putting pressure on that SI joint or going into lumbar spine, or below into the knee and maybe even down to the foot. So that's really interesting. So when I talk about, I teach people about, I call them hip lights, and I put my hands like this on my hips,
Yep.
and heart lights. And so in that case, your hip lights would not be facing forward for your body because you have that limitation, that external rotation in the whole inner thigh area, right? Is that right? Where the restriction could be tightness maybe in the inner thigh?
So this is the difference. This is the distinction. What I'm talking about is not muscle tightness that will change with time. What I'm talking about is structure that will not change. So for example, if the hip socket, now you had hip dysplasia, so your hip socket could do all kinds of things because it's a shallow hip socket. Somebody has a deep hip socket and they don't have enough external rotation because they're hitting the joint. So it's just not going to be happening. Then their pelvis needs to angle, because if they don't, they're going to be creating damage in the hip. And honestly, I would guess that that's why so many yoga teachers and practitioners have forced their bodies to have the headlights facing ahead, the knee facing that way. And I will tell you, 35 years of doing this, endless people I've looked at, very, very few, only those who are hypermobile can do that. Very few bodies are structured for that. And I'm not talking muscle, fascia, that structure. I'm talking bony structure.
Right, which is not going to change, like you said. Yeah, that's interesting. Because the thing about the hip socket that I found fascinating is that when you're little, there is no bend there's no femoral neck. The legs are straight up and down until you weight bear and walk, and that's when it starts to bend in and create that pressure in the acetabulum to create the depth of socket. So
For stability. Yeah.
It's amazing. I found a video of myself crawling on my inner knees. So I'm sure I had congenital hip dysplasia. Did not know that my whole life until, yeah. And now it's interesting because I have one hip replacement that was put in at a regular angle, and I have one hip dysplasia. And so I feel my body managing this. Like I feel it. And it's even gone up to a little scoliosis in the top of one side, because I have so much body awareness from my journey of all of this, and then from teaching and learning and becoming a yoga therapist. So it's so intriguing to me. But now you're just really getting me to understand that this hip dysplasia, real hip, is not going to change. But I want to maintain the strength in that hip. So now I'm going to think about letting it be in its aligned position so that whenever I do a posture that's going to create compressive force, whether that's triangle is probably the easier one for that, Warrior 2 side angle, I'm really going to think about that. Or even if I come into half moon or anything, I'm just going to think more about, I'm going to bring my mind into the top of my hip joint. I'm going to be like, okay, acetabulum, where are you at the center? So I can create those forces and be okay with whatever it looks like and whatever it is.
Yeah, I think that's, in yoga, we talk about the kleshas, like these are the things that cause our suffering. And one of them is raga, attachment. And the attachment that causes so much suffering in modern yoga asana classes is attachment to looking like something, right? Like it's supposed to look like this. And if we can, as teachers, distance from that and rather support people in what you're describing is knowing their bodies at a deeper level, having right relationship with their body, listening to their body, that can empower people towards better health. And then it almost seems comical that we would be even considering make your body look like this picture in a book. It's like almost comical, right? Because why? What's
Yeah.
magical about that? I'll tell you, I've read all the Hatha Yoga texts. Nothing tells you that your knee has to be here and your pelvis has to be here in a warrior position, because it's not in anything. That's besides the point.
Yeah.
But that's the other component that you bring up that I think's really, really valuable is I'm very interested in what we call the subtle body. So in modern medicine, we have the gross body. What can we look at, touch, feel? What's real? And in the yogic body, we also have the subtle body, which we can't see, we can't assess, we can't identify. And it's the essence of yoga. And what's really interesting in modern medicine is we have a few things that allude to a subtle body. For example, the science of body awareness. For example, if someone has chronic pain, there are many studies that show that their awareness of a limb is not accurate, right? The studies that I find the most fascinating, so if you haven't seen them, there's kind of a trip to look at. They're called the rubber arm studies. Have you heard of those?
I don't think so.
These are fascinating. There's over 100 of them, studies done, where they seat somebody at a table and they'll put their arms up on the table, right? One arm will be covered so they can't see it, and then they put a rubber arm. So the person, proprioception is my arm's on the table, right? But they're not looking, they don't see that arm, they see the rubber arm, and then they see their other real arm. And then some of the studies would stroke them. Some of them were more, I don't know how they got past ethics, they would stick a needle in them. And basically what happens is the subject would take ownership of the rubber arm. And after a while, after they stopped stroking the real one and they would do the rubber one, they would feel the sensations, even though it wasn't their own arm. They could actually feel it. And then they would say they have pain, or they could feel all these things. It wasn't even their arm. It's like, wait a minute, but that's not theirs, but they thought it was theirs. And all these studies on distortion, body distortion based on what we perceive. And so knowing that in chronic pain, we have in our mind a distorted understanding of our body schema, as we call it sometimes, or in our body awareness, that makes me think, well, in yoga, we cultivate awareness of subtle body. We cultivate this understanding. Even in Patanjali Yoga Sutra, it's said that by focusing on this central point, you can understand the whole makings of the body. You won't even need an MRI or X-ray kind of like interpretation. So cultivating the awareness of our body, where we are in space, what are we feeling? It's a practice, right? Some people are really good at it straight up. Other people, it's difficult, elusive, and they need to keep practicing. And we might do like contract and relax, things just to bring the mind to become aware of it. And once you cultivate enough skill at that, then somebody might be like at your level where, oh, I can feel that this hypermobile hip feels most centered and secure and happiest at this place of being. And that's golden for your yoga practice, for safety and stability.
Yeah. Okay, so how would we know if it's a joint? Like, so is it really the compression? So I want to know the difference between stretching and compression. And I know you said that if you go towards a direction, if you draw your knee in and you're feeling right where the groin is, right where your leg attaches to your body, that's more of a compressive feeling. So like for example, if you're sitting in a seated position and then you spread your legs wide, that's an area where I feel a lot of people, we're not in a wide-legged stance often. So I feel like in a seated position, legs out to the side, it seems to really be a humdinger for a lot of people. They either feel it underneath the hamstring area or they feel it in the adductors. So is there a way to identify with that wide leg stance? Is there a way to identify what would be the safest way there? Like how to identify the joint and where the hip joint should be in terms of how wide you put your legs versus it being muscular tightness, whether it's adductors or hamstring muscles?
Oh, this is such a great question because it's so complicated. And you're touching on something really important, which is I'm talking about skeletal uniquenesses and how we kind of respect that. And yet we're not just a skeleton because we're a dynamic structure. I actually heard recently in a continuing education course that embryologically when our fascia develops, how it folds on itself, and essentially there's no beginning and no end, which is really fascinating that it's just this one container. And as you probably know, there's been a shift from focusing on individual muscles to even considering that the fascia compartmentalizes muscles, and muscles do based on how they function. But fascia is getting more and more and more study in mainstream medicine. And one of the things that's being acknowledged is it's part of our immune system and it's part of our nervous system. So this is a structure that's not just fibrous connective tissue. It has many functions. It's actually got fluid in it, just like we have synovial fluid. The fascia has fluid, which they only recently discovered because they saw it in vivo and in real life and saw, oh, look, there's actually fluid. This is a fluid structure. It's a live structure. It's constantly adapting. What's it adapting to? What we do. So one of the great things about yoga asana is we do all kinds of things, right? It's not like you ride a bike and you do the same activity where your body then has the same movements. But in yoga, we go in all different directions, which helps to keep all these fluids moving, helps to keep our body mobile, and a lot that we don't understand yet. So why do I say this is that every position we put ourselves in, you've got not just the muscles like the adductors on stretch and the hamstrings on stretch, which for sure they both are happening and can be limiting factors. The fascia is really, and our nervous system is really wound up in that position. So if you think about your brain, coming out of your brain is your spinal cord. Coming out of your spinal cord at every level of your vertebrae are all nerves that go to all extremities. So when you put your legs out straight, and even if you bend forward, you're really winding that tissue up. And if it hasn't gone there in a while, it's going to create tension that's going to hold you back. So you've got nerve tension, what we call neural tension. You got those muscles you were talking about. And then you have the fascia that's kind of wound up, asking it to do something that involves that give. No beginning, no end. You're taking up slack in all kinds of places. And then we have our skeletal uniquenesses. So we've got all these factors to think about. So again, in general, what I would say is if you're feeling it in those muscles, then usually where you're feeling it is, we would think that is the limiting factor, right? If you're feeling it in your adductors, we would think that that's the thing that's limiting you at that particular moment in time. So back off a little bit, breathe, let go, and recognize that tissue tension needs some time to release, and different tissues need different time. And there's a whole debate on, is that muscle? Is that fascia? What is it, right? Is it nerve tension? I won't go into that debate. The point is, can you get that to let go so that as you stay there, so maybe you gain more flexibility. Sequencing is important. So before going into that posture, we might do things that release out the posterior leg, hamstrings and fascia and all those tissues. We might do something like Baddha Konasana, release this. We might mobilize the hips a little bit, get that hip flexion working, and then go into this posture that involves all of these, right? So if you're in that posture and the hamstrings and posterior tight, you're going to be in a posterior pelvic tilt. right? So if you're in a posterior pelvic tilt, that turns your acetabulum in a direction, which now in that direction, you've got more stretch on those adductors, and it's gonna be harder for your spine to come forward because it pulled you in a posterior tilt. That's why we would release that posterior body first. So I know I'm getting complex here. Is that getting too?
No. I was always so intrigued. I mean, I haven't taught live since 2020. But I was always so amazed by that posture in particular. And I think they were amazed. That's the biggest thing is it just brought up like, whoa, I'm so tight. Like that was, they would say, I'm so tight. But it was all, for me, it was interesting that it was either adductors, because I always thought that leg spread would be more of an adductor stretch. Yet
Yeah,
so
adductor
many
stretch.
people had issues in their hamstrings. They felt it in their hamstrings. Like for me, I don't feel it at all in my hamstrings. I would only feel adductor. I mean, I don't really feel that at all anymore. So it's just so interesting.
I feel it in my hamstrings.
You do?
That's where I do. Yeah, and here's the thing, and this is another point is if, for example, if they're in that position and they drop their head down and they feel it more in their hamstrings, that tells me it's not really just the hamstrings, right? It's neurofascial stuff. So that's another like simple test is I have someone there and like, oh, my hamstrings are really tight. Okay, let's see what happens if you tilt your head down, because there's no muscles that go from the neck to the hamstrings, not one muscle, but there's fascia and nerve that connect. And if that makes them feel tighter, it's like, okay, let's move some things up here maybe. But what you're talking about is a posture that involves so many tissues, so many, and the hip itself, because the pelvis, if they can't be upright, the pelvis tilts backwards, and now it's changed the hip. So I agree with you. That's a tough one.
Okay, good. Because I used to be like, wow. I mean, you wouldn't think that it is. You know, when something's not so challenging for you in your body, you don't always understand. And that's what my journey of my hip actually did for me. It kind of took me back to beginner body. So I used to have a very strong yoga practice before my hip situation. And then I had to go back to beginner body, not beginner mind, because you can't take away the mind of all the wisdom of yoga that I'd been practicing for all those years. So it was so interesting for me to have to go back to beginner body, but with not this beginner mind, and slowly and surely bring safely back in strength and flexibility. And that's what I do with
wise way. Yes, the wise way, in my opinion, in my perspective. Like, and like for an example, well, we say it's beginner body. And on another perspective, it's actually advanced because you're listening more deeply. So the beginner body could be that perspective of the physical only. Whereas from my perspective, it's being approached in a more advanced, deeper connected manner. And the physical may look more beginner. In actuality, it's a more advanced practice, I might argue, if that makes.
I wouldn't even say argue. So what I say, we go slow. I do not teach any flow work. I'm not moving through joints quickly. I want them to explore, to be a part of the journey and not the destination. We might be going towards Warrior Two, but I want them to notice what's happening along the way. And you're going to bring more into my teaching when it comes to joint alignment as a part of that, really being in the joint, but having that awareness. So when we go slower, I say slower is harder. Slower is more advanced. Slower is going to develop more strength in your muscles, your joints, and your bones, and your mind.
Yeah.
Yeah.
I'm 100% with you. I think to me, that's the wise way to go about it. And it's more about the yoga, because yoga is about awareness. It's not about achieving some physical preconceived idea. And to do that, like, for example, I might have somebody in a chair to do that same posture you're talking about in a chair, wide legs, knees bent first. So you've taken out the hamstrings. Find the difference of the pelvis. Notice when the knees are apart, that the pelvic position, right? And that find where can you have that position that enables you to come forward, that you're not being sucked backwards, and then gradually work towards getting the legs straighter out before coming all the way on the ground. Now somebody's found all these things in the key places, their pelvis, their hips. And now they have some sense of what it can feel like. And then when they get on the ground, oh yeah, wow, my hamstrings are pulling me back there. Yeah, I grasp it now. Whereas when you get to that place, there's all these factors. It's hard to know what's going on.
Okay, so that just brings up more stuff for me. You just said bend your knees. So then I'm starting to think about the hamstring muscle. When you bend your knees, you go more into the belly of the muscle. You get away from the origin and the attachment. Then you're not on bones and joints pulling. So I started to think of that when you were saying this. I thought, wow, that bent knee straddled leg position is going to be more adductor, right? That's going to go more adductor. You're taking hamstrings out because when the legs are straight, now you're straightening that knee. Now you're pulling, because when I teach Supta Pada Gustasana 1 or Supta Pada 2, the intention is a straight knee joint to be using the hamstrings to pull on the pelvis at the origin, to pull on the bones.
Oh, for the bone strengthening piece,
Yeah,
you mean?
for bone strengthening. But when you're saying, you're just raising my awareness that to make things easier, bend more things. The more straight the joints are, the more you're going to be pulling on them.
Well,
in that posture.
And yeah, so that's a great thing picking up. So it looks at like, what are we working towards? So I would say yes. So from your point of, if I'm focusing, I want to strengthen bones, so I want to have these pulls, makes sense to have everything straight. If somebody can't get there or they're struggling, then start with knees bent, find the position of the pelvis, and then take the legs out piece by piece by piece to be safer to get there.
Yeah. It's like safety valves. It's like releasing safety valves and not bringing everything onto you. It's crazy. It's really, yeah, that's just so interesting. It's the safety valves.
And then if we add on top again, it's like all the fascia and all that stuff. And how is someone breathing? How are they approaching this? Is their body going into a fear state, which is going to create contraction and fight against what they're doing? Or is the body able to welcome this and have a mental positive image, which then makes the whole experience more beneficial? So all these layers is why it's a practice.
Yeah. And so now what you just brought up for me is the breath is the connection between the body and the mind. And so when you bring your awareness to the breath, you now have your intelligent mind and your intelligent body, and you have this conduit, the breath, and you're coming to the present moment, and you're able to actually be in that place of discernment. Is this proper? Should I be bending this deep? Should my hip be in this position? Should I be doing this? So that breath really coming present moment, that's when, and that is when it's yoga, right? When you're breathing, you're practicing yoga.
All of that. And one more piece is that when you're doing all that, the physiology is able to let go more, so that it's less apt to have risk of injury, pulling something, tweaking something, muscle spasm, strain, because that approach, your tissues aren't going to have reactive guarding as much. So all those things you said, and a physical effect, the breath has that, the focused breath has that capacity.
Yeah. Oh my gosh. It's just so crazy. I mean, I think yoga is the answer, Lori, for everything. I think yoga is the answer for the physical body, for the muscles, for the bones. It's the way to manage stress, which is going to manage everything. Like this package that we live in, we need to it's a whole everything. It's the mind, the body. And most people don't realize that yoga is really for the mind. It's the, the guidebook of yoga, the sutras, 195 or 196 shlokas, depending on which version you look at. Three are on asana. 3 are on the physical practice. 190, either 2 or 3, are on the mind and management of the mind. And how do we liberate ourselves from suffering as a human?
Yeah, and then even the hatha yoga texts that are all these physical practices, the goal is still liberation from suffering, and the health benefits are the side effects. Like, oh, and by the way, it will cure all these diseases, and oh, by the way, it will do all these things, and oh, by the way, don't forget, we're doing this to release from suffering, and it has all these amazing health benefits. So I agree with you. It's a very efficient way to have a ultimately it could be for liberation, and it can be for a more enjoyable life, depending on how you apply it. Yeah.
Yeah, not getting caught up in the weeds of life. I say that I imagine that everybody's like a bunch of ants scurrying about, and whenever the going gets tough, I get going. I like pull myself out as if I'm floating above. I'm like, I'm not playing that game. I'm not going to get caught up in this. I do it often, like whenever life is happening to me or for me or whatever, I just kind of try to bring myself out of the heaviness of it and try to really takes and be present moment with breath and think like, okay, this too shall pass.
It's a great, great, great way of living life. I'm right behind you on that one. Awesome. Yep.
Yeah. All right. Anything else you'd like to share with us? I know that you have some things that are really important for you. Anything you'd like to share? Things that you're doing?
Oh, goodness. Oh my gosh, always so much with it. Being in healthcare, one of the things that I observed over all the years is that the body gives us messages, and oftentimes we don't listen until it's screaming at us, right? Because we kind of expect our bodies to do what it does, and if it doesn't, we get frustrated. Like we take it for granted sometimes. It is an incredible, I'm gonna call it a machine. It's beyond a machine. If we think about all the things that our body does every single day, it's literally mind-blowing. The right amount of this chemical, the right amount of that chemical, the right amount of this hormone, the right amount of this, it adapts to this, our environment, so many things. It's actually this incredible, I call it an earth suit. It's like, this is my suit while I live this life on this planet. And think about all the things we have to do for our cars and all this stuff. And like, so how are we taking care of this body, and how attuned are we to the messages? There's one thing I would say, because as we're teaching people to be attuned and we're trying to listen to our body and listen to the messages, and like, what's it telling me? What am I supposed to be doing? Because when we go to the doctor's looking for illness. They're looking for when something's broken, and then how do we fix it? That's what most of it is. And some of it's preventative. You're doing a lot of preventative. You're doing all kinds of great work helping people identify where they might not be able to when something's going off course, and how to get it back on course before it's too late. Most disease started with dis-ease. So if we can start to identify when we have dis-ease so we don't end up there, that would be a great thing. The interesting part is that how are we listening to these messages? So there's some research that looks at why is it that people who practice contemplative practices such as yoga, different types of meditation, because yoga has meditation, all these different practices, they score higher on what we call body awareness scales, which assess how attuned are to, like, I know when I need to urinate, I know when I have a stomach ache, like all these things. People who have chronic pain also score really high because they tend to be hyper focused. Oh, what's that? Oh, it's that. Oh, it's that, right? Hyper focused to sensations. So what's the discernment between these two, right? Why is it that one, it's dysfunctional? They're hyper focused on every message, and it's actually known to create increased symptoms. The other also has hyperacuity to these symptoms, but they down regulate the symptoms. They can actually bring them down. And the thing that I would argue is the difference is that this group, it's non-judgmental awareness. So when we practice yoga, when we practice mindfulness, these practices, what we're cultivating is non-judgmental awareness. And what I mean by that is listening to the messages of our body and being careful not to create a story, which I've done. I had a bad headache. Oh, it's a brain tumor. I'm sure it's a brain tumor. It's definitely a brain tumor, right? And then go into this, and then the symptoms are worse and everything's bad. And then you go to the doctor and you find out it's not a brain tumor, and boom, the symptoms are all gone. Right? That happens a lot with chest pain. A lot of people can have chest pain, and then before they go to the doctor, it's like worse and worse, and you're pretty sure there's this major heart disease going. And they get the workup, and the workup's totally fine, and then the symptoms subside. It's not crazy. It's not like they're all in their head. It's literally that the messages have more to do with our beliefs and our thoughts about them, the symptoms, I should say, more to do about our thoughts and our beliefs than actually tissue pathology. This is part of chronic pain science, right? So the degree that someone has pain, and we're talking about skeletal, we're talking about physical bodies, so the amount of symptom, the amount of discomfort, the amount of pinching, the amount of pain, the amount of all of that has less to do with something being wrong and more to do with what you think and believe about it. The degree of symptom. So that means that it's not reliable. You can have very little symptoms and have something really going seriously wrong, or you could have severe symptoms and have something minor going on. It's not super reliable. So what we can do is cultivate greater awareness of what's our body's norm, and therefore identify what's new and different. How much can we have non-judgmental awareness? Like, oh, that's really interesting. It's feeling, what's that sensation like? And exploring it without creating all kinds of labels. And then we create deeper discernment in yoga viveka, right? Deeper understanding of what should we go see a doctor for? What are we able to self-manage? And that greater awareness, so that we don't teach people to be terrified of every single pinch and ache and, oh no, I'm creating bone, I'm creating some terrible thing. I don't want to give that message, is why I'm sharing this. That's not helpful. It's to be able to identify, how can I work with my body so that I'm using it, it's more comfortable, it's safer, I can build my bone, I can build my strength, and I can minimize the risk of creating injury. And feeding dysfunctional body awareness.
So interesting. So as yoga therapists, we look at a 5-layered approach to the human, right? We look at the physical body, we look at the energetic body, we look at the mind as it is. And I'd say that that's pretty much where a lot of people are, in kind of what you're saying here. Then we go into those higher levels, and maybe that is the next to the layer of discernment, and then that layer of connection to bliss body. So maybe it really is that Vijnanamaya and Anandamaya layer, those two higher centers, that those of us that practice yoga or these kinds of practices, maybe that is where we're going with all of that. Maybe, I don't know, maybe that probably, I mean, that's what you're making me think. As we're speaking, you're just like really stimulating my mind to go into a place of inquiry. And yeah, I mean, I can honestly say I have no pain in my body at all. And I'm very aware of my body. And if I do have something that's uncomfortable, I want to say the words nip it in the bud. But I also spend a lot of time to take care of myself. So I really do live a very healthy lifestyle. And I think that that's a part of it. And yeah, it's really so interesting.
It's so great to hear that you're modeling what really, really can help by teaching people. You're modeling that is, you know, that thing that's aching in there. A lot of us tend to just push it aside. Other people panic at every sensation in their body and make a big deal. And there's a balance in there. And that is that process of really using that physical yoga practice to be in the body, to bring all those pieces together. Yeah, that's such a gift that yoga gives us, an opportunity to dive deeper into and explore, and then kind of go in those deeper, more subtle layers that ultimately can bring us to more bliss.
Yeah, it's all about balance. And as you know, specializing in bone health, the thing that I would say most people share as a fear or a big concern, if I ask about main complaints, balance and losing balance is what a lot of people say. So yeah, we have to stand on one leg or come into certain postures, half moon, dancer, challenge our balance. But we also need the balance internally, physiologically, what you were saying in terms of using breath and having that shift in the fascia and the internal tissues, the fluids that are internally. And then we need that mind balance. And then the balance between our whole entire being, our physical suit, our mental suit, our spiritual suit. And the word yoga is that. The word yoga is to find that harmony and that balance between the physical, the emotional, mental, and that spiritual side. It's mind, body, and soul. That's what this practice is. I just love yoga.
Me too.
All right. Well, Lori, thank you so much. I am so glad that you shared this. This podcast, Stronger Bones Lifestyle, I created this because I want women to know what is possible. And I want to empower women to know, how do you take care of yourself for the rest of your life? And how do you give yourself the best quality, the best chance to have the best quality? And it is in our hands. It's in our hands with what you shared today about self-assessing, about detaching and not getting caught up in the moment, and really identifying what those signals are the body's giving us, and doing what we need to manage them so they don't become louder sounds and they don't become chronic and from so many different angles as they are with chronic pain. So thank you. You shared a lot of great information today for
And you just
this
summed it
audience.
up so beautifully. So beautifully. Yes. Thank you. It's really been fun being with you here. And I'm super excited about the work that you're doing.
Thank you, Lori. Well, you've been a big mentor for me in my life, and you've helped me. Your voice is in my head for a lot of what I share with people. You're there. So what I'm doing and what you see do, and especially when it comes to yoga, you're there because you were my guide for a lot of that.
And now I'm going to have you be my guide as I go through building my stronger bones at this phase. So thank you. Yes.
Yeah, paying it forward, paying it back, whatever, the whole cycle,
Yep.
the whole circle.
Symbiotic. Well, thank you. Thank you
Thank
very
you.
much.